Hi, everybody. So my presentation is over my first article, which was about behavioral and physiological effects of coronavirus disease and the COVID-19 quarantine in patients specifically with dementia. And this was my quantitative article. So a little bit about the background and the questions being explored within the article. The first one being the aim of this study was to assess modifications of neuropsychiatric symptoms during quarantine in patients with dementia and their caregivers. So this study was centered in Italy. It took place shortly after Italy's lockdown, a couple months after the lockdown. So the first COVID-19 case was confirmed in February 2020 in Wuhan, China. Um, and then shortly after that same month, the first confirmed case happened in Italy as well. And then the mass lockdown in Italy occurred in March of 2020. So this study shortly followed March. It started in May of 2020. So it kind of gave that short little window to fully assess the effects of quarantine with dementia patients and their caregivers. And so uh, the study was kind of building upon these previously researched effects of quarantine, specifically with the SARS virus and the MERS virus that occurred in the late 90s and early 2000s. So these Italian public health experts were trying to compare if COVID-19 had similar effects as did the SARS and MERS lockdown, because those studies already showed that there was negative consequences and negative effects of lockdown within dementia patients and their caregivers. The significance of the research area, there was three big ones. There was a call to action. Previous lockdowns already showed that there was a negative effect in terms of lockdown with dementia patients. And then it's a time to change. So the call to action was that there was no real research out there in the current time with COVID-19. Since COVID-19 was so new, nobody knew exactly the real effects that it had in general, but specifically to this, the effects it had on dementia patients. So these public health experts started this research to kind of bring to light the effects that it had on memory care patients. And since it's such a big thing, since the SARS and MERS virus, like I said, the significance is the other thing was previous lockdowns. Since SARS and MERS already showed that there was this huge problem and this huge effect on dementia patients, that there was a significance into that as well as the significance was time to change. That it's time that we kind of adjust. Since there are these huge behavioral, mental, and physical effects of lockdowns on dementia patients and their caregivers, then it's time to change in terms of how we go about handling quarantine, how we go about handling quarantine in specifics to dementia patients. It's kind of like a call to action to the public health community. Some methods of research, how this study was actually conducted, it was an observational sub-study with a larger multinational survey conducted specifically in Italy and all parts of Italy. It wasn't contained to one specific region of the country. And what it did was public health experts and researchers evaluated the effects of quarantine in COVID-19 quarantine on cognitive, behavioral, and motor symptoms of patients specifically with dementia, Alzheimer's, and Parkinson's, kind of like cognitive related deficiencies, and the impact of quarantine that it had on family caregivers and changes of health service devoted to dementia care. So basically, there was two parts to this. So the first part of the survey was asking specifically caregivers if they've noticed any changes within their loved ones with dementia, if they've noticed any major behavioral changes, if they've noticed any more wandering, if they've noticed any more rejection of care, basically any changes in their overall sense of self, or are there any rejection to ADLs. And then as well, the second part of the phone interview was asking specifically to family and caregivers if they themselves are feeling the strain of isolation and quarantine with their dementia loved ones. And so there was asking, it was delivered by a phone call and a semi-structured interview to family caregivers of patients specifically with dementia. And then there's 9 questions regarding modifications of dementia-related symptoms being asked. In particular, caregivers were asked whether patients had worsened one or more of the following: PPSD, which was specifically what I just said, ADLs, if they've worsened in terms of mental health, etc. Family caregivers explored 16 domains concerning demographic and social characteristics, lifestyle and work changes after quarantine, use of medical care and health services for patient needs, and psychological effects of pandemic. What that's saying is um, these questions were specifically related in terms of the questions being asked of the family caregivers if their life um, has changed, has their lifestyle had to adjust due to the lockdown with their dementia, has their work been affected, has their overall mental health been affected, and so that's what it's just focusing on. So the hypothesis to this research study was similar to the aim of the study. Um, it was if a person with dementia is subjected to a change in routine or lockdown or quarantine, then their behavior will change. So basically, the researchers are going into this study with previous data from the SARS and MERS researchers, and they've they have this pre-hypothesis that yes, COVID-19 will have a negative effect on patients with dementia and their caregivers. These are the major findings within the research. So I will kind of explain this to you. So the questions being asked, this was specifically related to dementia patients. These were related to the dementia-related questions. So the changes in apathy, anxiety, depression, sleep disorder, delusions, hallucinations, irritability, aggressiveness, wandering, agitation, change of appetite, the major changes in their overall mental and physical health was being asked. And so you can see here that there are huge major changes, worsening BPSD, 34.5% of everybody said apathy. And then it was the new onset. So basically, a huge majority of the study was saying that yes, their PPSD was worsening or they had a new onset BPSD due to COVID-19 related lockdown. The limitations and strengths. One limitation would be the location of the study. It was confined only to Italy. It was not spread out into other countries as well. So it's so localized that we can't assume that this had an effect on every single dementia patient all around the world. Families of dementia patients were biased to their behavior. So some of these family members were bringing them in from nursing homes, from skilled living facilities that were on lockdown. So they're bringing them back into their home-like setting. So they might not have been around them as long, so they don't really know their behavior. If this was a new onset or if this was a change, they don't know. And then people directly dealing with the residents as well as they were non-medical. So basically saying that they don't know if this was a new change, if this was something new, if this was just a day-to-day thing, if this was just a daily change, is this a new onset, like real change? So there was like little limitations to the study. A strength would be that these experts who were conducting the study were actually on the studies with SARS and MERS, so they already had that base knowledge with it. Takeaways from interviews. So connecting in my research essay, I interviewed Preston Horn, who is a licensed nursing facility administrator in Fort Worth, and his memory care patients. So basically, the overall takeaway from that interview was that Preston was saying that running this memory care home, he saw the huge drastic change with memory care patients, isolating them to the rooms, isolating them from their loved ones, and seeing that huge behavioral change with his memory care patients. So I was connecting that interview to this overall study because both of them kind of concluded the same thing, that yes, this isolation, this quarantine with dementia patients had this huge effect on them. Recommendations of practice. So using this study with our future patients would be kind of changing skilled nursing protocols or future lockdown methods. How can we keep dementia patients safe, but also keeping them from uh, changing in terms of worsening BPSD or new onset BPSD. So how can we change these lockdown procedures and our nursing protocols to help change uh, that as well? So thank you.